Rare conditions, also known as orphan diseases, are health disorders that affect a small percentage of the population. In the United States, a disease is considered rare if it affects fewer than 200,000 people, while in Europe, it's classified as rare if it affects fewer than 1 in 2,000 individuals. Despite their rarity, these conditions can significantly impact the lives of those affected, often leading to unique challenges in diagnosis, treatment, and access to care. Overview of rare conditions prevalence. There are approximately 7,000 known rare diseases affecting an estimated 25 to 30 million people in the United States, which is about 1 in 10 individuals. The exact prevalence varies by disease. Examples of rare conditions: Ehlers-Danlos syndrome, a group of connective tissue disorders that can cause hyperflexibility, skin that bruises easily, and various complications. Apert syndrome, a genetic disorder characterized by the fusion of certain skull bones, leading to a shaped head and face, as well as potential developmental issues. Harlequin ichthyosis, a severe skin disorder that causes thick, hard skin covering most of the body, leading to complications. Progeria Hutchinson-Gilford progeria syndrome, a genetic condition that causes rapid aging in children, leading to severe health issues, including cardiovascular disease. Osteogenesis imperfecta, a genetic disorder that results in fragile bones that break easily, often referred to as brittle bone disease. Challenges in diagnosis: limited awareness. Many healthcare providers may not be familiar with rare conditions, leading to misdiagnosis or delays in diagnosis. Symptoms overlap. Rare diseases often share symptoms with more common conditions, making it difficult to identify the specific rare disease. Access to genetic testing. Many rare conditions are genetic, but access to appropriate genetic testing can be limited. Long diagnostic odyssey. Patients often face a long and complicated journey to diagnosis, sometimes seeing multiple specialists before receiving the definitive diagnosis. Treatment challenges: lack of research. Due to their rarity, many conditions have limited research, which can hinder the development of effective treatments. Limited treatment options. While some rare diseases have specific treatments, many do not, leaving patients to manage symptoms without targeted therapies. High cost of medications. When treatments are available, they can be prohibitively expensive, particularly if they are newly developed or involve biologics. Access to specialists. Patients may need to travel long distances to see specialists familiar with their condition, which can create additional barriers to receiving care. Support and resources. Patient advocacy groups. Many rare conditions have associated advocacy organizations that provide resources, support, and information to patients and families. These organizations often work to increase awareness, fund research, and promote policies that support individuals with rare diseases. Clinical trials. Patients may have the opportunity to participate in clinical trials that investigate new treatments. These trials can provide access to cutting-edge therapies that are not yet widely available. Multidisciplinary care. Many patients benefit from a team-based approach involving various specialists who can address the different aspects of the rare condition. Government and non-profit support. In many countries, government initiatives exist to promote research and provide support for rare diseases, such as the Rare Diseases Act in the U.S. and the European Union's Orphan Drug Regulation. Conclusion: rare conditions present unique challenges for diagnosis, treatment, and overall quality of life for affected individuals and their families. Despite the obstacles, advances in research, increased awareness, and support networks are improving the outlook for many patients. For individuals facing a rare disease, connecting with advocacy organizations, participating in research opportunities, and engaging with healthcare professionals who specialize in rare conditions can provide invaluable support and resources. If you or someone you know is affected by a rare condition, seeking out information and support can be critical in navigating the complexities of these diseases.